Good afternoon, and welcome everyone to the third meeting of the Senate Committee on Health and Human Services for the 83rd Legislative Session. Madam Secretary, please proceed to call the roll.
Senator Lang, Senator Stone, Senator Taylor, Senator Titus, Chair Doniate.
And I'm here, and please mark Senator Lang present when she arrives. Good afternoon, everyone, and thank you so much for being here. Today we have a few bill hearings. We have 3 bills up for hearing: Senate Bill 24, Senate Bill 43, and Senate Bill 185. I mentioned that in that order because that is the order that we will be doing the bill presentations. I do have a few housekeeping items to get over so that way folks can start participating. So just a few notes. Please note that the agenda items may be taken into a different order as listed, and 2 or more agenda items may be combined for consideration. If you wish to testify today, please sign in at the table by the door and provide a business card to your committee secretary. If you do not wish to testify, you may also want to sign in so that there's a record of who's in the room. When testifying, please turn your microphones on to speak and off to listen. And we have listeners both online and viewers in Las Vegas that are looking at this meeting. As in the past, any person proposing an amendment to a bill being heard by the committee must submit the proposed amendment in writing no later than noon on the business day prior to the meeting. And we ask that public comments be kept to 2 minutes so that everyone interested can speak and they can be accommodated for. And finally, we ask for folks to please turn off their electronic devices, especially cell phones, or put them on silent during the meeting. We're going to go ahead and start with Senate Bill 24. So we're going to go ahead and open the bill hearing now on this bill. This bill provides for the certification and regulation of emergency medical responders. With us, we have Administrator Cody Finney, so please, or designated staff. So please begin when you guys are ready.
Good afternoon, Chair Donate and community members. Guess I have to get closer to the saying. As you can see, I am not Cody Finney. I am Deputy Administrator Kyle Devine with the Division of Public and Behavioral Health. With me, I have Bobby Sullivan, who manages our EMS office. Senate Bill 24 adds emergency medical responder as a recognized pre-hospital provider in statutes. This provider type was previously called a first responder. When previous legislation changed the naming of emergency medical personnel to be consistent with the national standards, emergency medical responder was omitted. The state currently recognizes the certification of emergency medical responders in state regulations, and Southern Nevada Health District does not. This bill establishes the emergency medical responder in statutes, allowing for statewide consistency, which greatly supports mainly our rural communities. Thank you. We're available for questions.
Thank you so much. Any questions from committee members at this time? So just as a clarification, we had this before, changes were made in law. Now we're adding it back so that we're in compliance with federal standards, right?
Kyle Devine, for the record, yes, that's correct.
Okay. No question. Oh, we're good? Okay. We're going to go ahead and testimony then. For folks that would like to testify in support for this measure, we ask that you can please line up. We'll start first in Carson City. Once again, this is on testimony in support of SB 24, and we'll start here in Carson City. Please begin when you're ready.
Good afternoon, Chair. Ryan Beeman, for the record, B-E-A-M-A-N, representing the professional firefighters in Nevada. Down in Southern Nevada, we have, just for Clark County firefighters, we have 15 rural departments. With this change, it actually will help out our rural division, as I mentioned before. We have long response to go out to help out those districts, and if we can get another certification, it would help out those rural departments in our area. Thank you.
Thank you so much. Anyone else in Carson City? Anyone in Las Vegas? AVH, is there anyone virtually?
If you'd like to testify in support on SB 24, please press star 9 on your phone to take your place in the queue. Chair, there are no callers wishing to testify in support at this time.
Thank you so much. Let's move on to testimony in opposition. Is there anyone here in Carson City? Anyone in Las Vegas? AVH, is there anyone online?
If you'd like to testify in opposition on SB 24, please press star 9 on your phone to take your place in the queue. Chair, there are no callers wishing to testify in opposition at this time.
Thank you so much. And last but not least, is there anyone that would like to testify in neutral on this bill in Carson City? Anyone in Las Vegas? Any AVH, is there anyone online?
If you'd like to testify in neutral on SB 24, please press star 9 on your phone to take your place in the queue. Chair, there are no callers wishing to testify in neutral at this time.
Thank you so much. Mr. Devine, do you have, or Ms. Sullivan, do you guys have any closing remarks?
Kyle Devine for the record. We just are very thankful that you're willing to hear this. We believe that this will be very beneficial to our rural communities and providing more personnel who can respond to emergencies. So thank you.
Thank you so much, and thank you for your service to the state. We'll go ahead and close the hearing on SB 24, and we'll move on to our next one, Senate Bill 43. I'm going to go ahead and invite Ms. Carr, who is an administrator for the Nevada Division of Environmental Protection, and her team to come forward. So I'm going to go ahead and open the bill hearing on Senate Bill 43, and this bill revises provisions relating to environmental protection. So please begin when you're ready.
Good afternoon. For the record, my name is Jennifer Carr, and I'm the administrator for the Division of Environmental Protection. I apologize, my bill probably won't go quite that fast, but I don't think it'll take too long. So again, good afternoon, Chair Doñate and members of the committee. I appreciate the opportunity to present Senate Bill 43 to you today. This bill is designed to address delegation of authorities from NDEP to local health districts. It's related to two programs specifically, the Safe Drinking Water and Solid Waste Management programs. This afternoon, I'll be speaking to the original bill as introduced, as well as the substantive conceptual amendment that you have before you today. So for a bit of historical background, Nevada's been managing the solid waste program has been managing solid waste since 1971 under Nevada Revised Statute NRS 444, originally under the auspices of the State Board of Health. Authority for this NRS shifted to the State Environmental Commission, which is NDEP's oversight body, in 1975, and the program shifted itself with the staff in 1977 from what is now the Department of Health and Human Services over to the Division of Environmental Protection under the Department of Conservation and Natural Resources. Permitting and oversight of landfills under the Federal Resource Conservation and Recovery Act, also known as RCRA, which is a federal program, was added to the Nevada Revised Statutes in 1993, and NDEP administers this program under federal delegation from the US EPA, the Environmental Protection Agency. Nevada's been managing the Safe Drinking Water Act since 1977, originally under the State Board of Health as well, with implementation by the state health officer and what were then known as health authorities, which included local boards of health. That same year, Nevada adopted the Federal Safe Drinking Water Act, 1977, which is now codified in NRS 445A. And in 2005, the legislature moved program implementation from the State Board of Health to the State Environmental Commission, and from the health authorities and the division to, from the health authorities, to the division and, quote, appropriate district boards of health, unquote. NDEP retains federal delegation of this program from the US EPA, and it's known as Primary Enforcement Authority, or primacy. Under federal law, these programs are delegated solely to the state. Nevada's drinking water law has been jointly implemented by NDEP and local health districts for decades. When the State Board of Health establishes a health district today, the health district automatically assumes responsibilities for the drinking water program under the original 1977 statutes. In contrast, implementation of the solid waste law by health district is optional, but in both cases, NDEP uses our interlocal agreements under the Nevada Interlocal Cooperation Act under NRS 277 to delegate program activities under our federal authority. Until recently, there were only two health districts, Northern Nevada Public Health and Southern Nevada Health District. In late 2022, NDEP became aware of activities surrounding creation of the Central Nevada Health District. And very early discussions revealed to us in conversations that we had with them that some of their original planning and goals, as they stated, were really about increasing local community health and wellness services. And they did not necessarily appear to include implementation of the drinking water program as an active part of the discussion at that point in time. So NDP has since entered into an interlocal agreement with the Central Nevada Health District as they acquire staff, and we help them to build training and capacity for the program that under current law they're obligated to do. Please note that NDP is not at all involved in the creation of health districts by the State Board of Health under NRS 439. The 2005 legislative relocation of the drinking water program under the State Environmental Commission created a bit of a disconnect in the process of delegating NDEP's federal authority and responsibility to others. NDEP has since become concerned about the lack of an assenting role in making a conscious decision on further delegation of our sole authority for federal primacy. Current law takes effect upon a health district's approval by the State Board of Health. As you might imagine, the Safe Drinking Water Act is pretty complex and it's extensive and covering a long list of federal rules and program elements and requirements, with a few of the most recent topics being standards for per and polyfluoroalkyl substances, or PFAS. You might also know them as forever chemicals because they're in the news that way. They've expanded the lead and copper rule, protecting children's developing brains and health from exposure to lead in drinking water. And we've also been working on issues such as cybersecurity for this critical infrastructure for drinking water. Similarly, the solid waste management program is increasing in breadth and complexity as more industries expand to Nevada, particularly solid and hazardous waste recyclers. And this growth brings challenges related to hazardous waste management and ensuring that businesses understand the applicability and scope of regulatory requirements. And this includes making regulatory determinations for each business related to the type of waste that they handle. In Senate Bill 43 as introduced and in the conceptual amendment, the key provisions are in Section 4 of the Solid Waste Law and in Section 20 for the Public Water Systems Law. Remaining sections primarily make conforming changes. The original language was well-intentioned as we were seeking to alleviate responsibilities for these environmental laws from newly forming health districts, recognizing that their larger focus is community health and wellness. Implementing NDEP programs has become increasingly challenging, and even the two long-standing health districts that have been doing this for decades have experienced various challenges over time to full implementation. Likewise, the introduced bill language structured the potential transfer of authority of NDEP to the health districts when at least one of their member counties reached a population of 100,000 or more people. Once the population cap was met, then a health district could seek designation of either program by providing the administrator of the division with a demonstration of capability, and then the division administrator would make that delegation of authority. This population cap would have returned the program to essentially the status quo, with two health districts grandfathered in. In the introduced language, as well as in the amendments, Section 34 is the grandfathering provision for the Northern Nevada Public Health District and the Southern Nevada Health District, allowing them to continue operating their programs as they do today. And that grandfathering provision is also in the amendment. However, we now recognize that this approach was a little short-sighted, and through outreach to the health districts that exist, the three health districts, as well as the potential new, what we refer to as the Quad County Health District potentially, because I don't know that they have a name yet. We reached out to the Nevada Association of Counties as well as others, and through that process, the conceptual amendment that you have before you began to take shape. Through that process, we were strongly encouraged to not just look at the challenges of today, but rather consider future opportunities for new or growing health districts. They encouraged an approach that would allow health districts to build their capacity over time and eventually take on these environmental laws that have a public health nexus. While recognizing NDP's federal responsibilities to the US EPA, NACO suggested removing the population cap that would limit a health district's potential to grow and seek delegation of these programs. So the conceptual amendment in sections 4 and 20, again, the primary sections of this bill, changed the programmatic approach away from a population cap to one where it provides a pathway for the District Board of Health of a health district to seek designation for all or part of these programs at any time. This flexible approach provides for a system where a district could even start small and build over time. Under the amendments and for the purposes of our overarching maintenance of federal delegation of these programs, the NDP administrator may designate a health district to carry out the applicable provisions of NRS 444 or 445A, along with their related regulations, if a health district voluntarily seeks designation and demonstrates its capacity to implement the programs. Such designation would continue to use the formal interlocal cooperative agreement to legally transfer federally delegated state authority for the elements of the program sought by the district. The interlocal agreement would clearly and transparently outline the scope of work and details of program implementation and designation. Also, to maintain NDP's federal primacy delegations for the program, the amendments outline terms for periodic review of the health district's designated program performance and act accordingly if the program is found to have deficiencies. If a deficiency presents an imminent and substantial threat to human health, public safety, or the environment, then there's provision for the division to revoke the program designation without notice to the district, effective immediately, but still having an opportunity for them to appeal to the State Environmental Commission. If the deficiency does not present an imminent or substantial hazard, then the division will provide a notice to the health district to correct the deficiency with a deadline of not less than 60 days. And the deadline can be extended upon mutual agreement. If the deficiency for somehow was not corrected, then the administrator may issue a decision of revocation. The solid waste law in NRS 444 currently contains similar program audit provisions and determinations of inadequacy is the word used there, that are included in section 14. You'll notice that these provisions are amended to be struck in the amendment in purple from subsections 1 and 2 because they are superseded by the new language in section 4. For the solid waste law, we're seeking to shift to a more proactive approach to building these programs with NDEP involvement. And with this change in the language, we would then have consistency between the language in 444 and 445A, just for consistency and ease of implementation. I would also note that under other sections of law and regulation, any final decision of the division can be appealed to the State Environmental Commission, so we have not added any specific appeal provisions to this body of law because it already exists elsewhere. Much of the remaining amendments focus on conforming changes, including removing the 100,000 population cap anywhere that it got drafted in, and revising language about designating health districts. However, there are a few key additional points that I feel the need to highlight. One is that NDP initially planned to use existing discretionary authority vested in the State Environmental Commission to create regulatory criteria for evaluating a health district's capacity to implement all or part of this program. As requested during the process, we've agreed that the language should be obligatory, and so sections 13.5 and section 23 state that the Environmental Commission shall adopt regulations establishing such criteria. NDP has an established history of seeking broad representation by stakeholders in our regulation amendment process under the Nevada Administrative Procedures Act. And given that the health districts are not just stakeholders, but truly partners, NDEP will ensure that they are involved right from the outset in developing the regulatory criteria that they will be evaluated against for demonstrating capacity. well before any draft regulations are even submitted to Legislative Council Bureau for drafting, and certainly before any formal public workshops required by NRS 233B. Concern was recently expressed about the process for showing capacity has been achieved. So in addition to defining what capacity looks like in regulation, we would also intend to cover how the process would unfold logically and in a manner that would help a health district achieve success. In another area, and during the process of language review, NDP identified a section of existing law in NRS 444 related to health district authority that was not included in the text as introduced. So a new section 8.5 has been added to address conforming changes related to health district permitting for management of waste tires. So it's just pulling something in that was missed and is consistent with the work that we're doing today. Section 10 was amended by LCB to add the population cap language into existing law that requires every municipality and district board of health develop a plan for a solid waste management system which adequately provides for the management and disposal of solid waste within its boundaries. NDP believes that the language that was changed in subsection 1 regarding designated health districts should be reverted to current NRS language so that the planning would continue to ensure local planning of management of solid waste by local health districts and local municipalities. So that change you'll see in, I believe it's orange. So most importantly, wrapping up, the amendments really ensure that NDP holds an active role in designating a health district to have state authority of the Public Water Systems Law based on a demonstration of capacity versus the current law that provides delegation of NDP's federal authority without our involvement on the day the health district is created. These changes provide the flexibility Nevada needs to ensure that regulatory oversight is assigned to an entity with appropriate capacity to manage these programs, or otherwise it's held by the division. Additionally, they create a level playing field for all current and future health districts and establish a pathway for discussions with the northern and southern health districts about their current implementation challenges, even though they're grandfathered in. Ultimately, these amendments will support interlocal agreements that are transparent and clearly define and reflect the roles and responsibilities of both NDEP and any of the health districts that would like to take on any of these roles. I'm happy to entertain any questions you might have, and today I also have Jeffrey Kinder, one of my deputy administrators, and Danilo Dragoni, another deputy administrator, with me today. Thank you.
Thank you so much. Committee members, any questions at this time? Vice Chair.
Thank you, Mr. Chairman. And thank you so much for the presentation. I've learned so much about this and in this, so I appreciate it. I just have a quick question. On page 17, towards the bottom, section 20, subsection 2, I believe you talk about the recommendation is to periodically review so that you can establish if a program can, really does have the capacity. What do you envision periodically? How often would that be? I mean, I know it's about accountability and so on, but how often, what's best practice on that?
Thank you very much for the question. Through you, Chair Donate, directly to Senator Taylor. Thank you. So that would certainly be outlined in our interlocal agreement with the health district that is either currently or taking on this responsibility. We do have regular touch points with the US EPA on our programs, typically semi-annually, with year-end reviews and those sorts of things, with various elements that are reported quarterly. So I would imagine somewhat of a similar system where we can collect the information that we need in order to be responsive to US EPA, either probably semi-annually or at the very least annually, to do a programmatic review. Semi-annually might be a little too often, but annual program reviews I think is a reasonable audit time frame. But we would be able to work that out, and it may differ depending on the health district. Programs that are longstanding and established might need fewer check-ins than one that is up and coming and growing. So, good.
Okay, thank you.
Thank you.
That's it for me, Chair. Thank you so much.
Senator Stone, do you have any questions? No? The only question that I had was on page 19 when it deals with adopting regulations to establish criteria. Can you talk more about what certain requirements you would institute in regulations for, say, a health district that would want to take this requirement? I mean, so some of the things that come to my mind, right, like if there was a such as or limited to section, would be, and these are just from my notes. I'm assuming there has to be a requirement of like minimum staffing that has to be equipped or hired on by the health district, 24/7 or real-time monitoring protocols for a whole wide range of like things that you're monitoring so that solid waste doesn't leak into the groundwater, et cetera, right? Which led me to, are there access to certified laboratories? Are there emergency response plans? Are there agreements with local hospitals in case of the crisis scenario does occur? Like, are there compliance mechanisms that have to be instituted before that even gets to? So if you can speak to that, I think that would be helpful for me.
Thank you very much for the question, Jennifer Carr, for the record. That's a really good question, and it covers a very broad array of things that that a program would need to have the capacity to handle. So generally, I would probably lump them into groups of, financial capacity to handle the program, whether that's from grants from us and or a combination of fees or something along those lines that the health district has to generate their own revenue. So some sort of financial capacity to hire the staff, as you said, needed to run the program, an appropriate number of staff. The technical capacity to run these programs. So, potential laws, not so laws, ordinances or standard operating procedures or training manuals, things like that would build the technical capacity of the staff in various elements of the programs, as well as the managerial capacity to handle the oversight of the program, whether that be through the administrative process of the health district and or their local board of health or something along those lines. And the two different programs are very broad. There are potential emergency provisions related to like an E. coli bacteria result in a drinking water sample that needs to be acted upon, immediately, potentially with a boil water order or something like that. And that is something that the agency deals with even on the weekends. And so there are a lot of things that we would be seeking to ensure are fully fleshed out by the programs. And so that regulation adoption process will really be able to dig in on all those various issues that you bring up so that we can try to define clearly what all our common expectations are.
Thank you. And just as a follow-up, it's my understanding, if I read the amendment correctly, that the only two actions that the department may do is either, or the punitive measures that you may have is either revocation of responsibility or just corrective action. Is that standard across other states? Do they have the same ability? Is there an ability to impose fines? Like, can you speak to that as to why that decision was made?
Thank you for the question, Jennifer Carr, for the record. The agency has different type of punitive measures that can be taken on the facilities that may be in violation of our laws and regulations, and that's where the fines and penalties come in. We don't currently have anything along those lines, and I wouldn't imagine that we would for our partnerships for the local governments that help to implement our programs. I don't know off the top of my head how other states, may have punitive, measures that can be taken for a failure to properly implement the program. But for us here, we would seek to correct it and to ensure that either they rebuild their capacity to handle an element where they're deficient, or simply the state takes it back.
Thank you. And that's fair. I think the reason why I was asking that was if there's a impropriety of malfeasance occurring from the health district, if, maybe they're not paying attention enough, or they promised that they were going to hire these staff or build these resources, and clearly they did it, and it results in some level of disease outbreak that could have been prevented had the county actually lived up to the expectation, right? Then it's like, how much corrective action can we do? But it sounds like at that point, if it does get to that extent, you would revoke it from them completely and say, we're not giving it back to you until you fix the issue, right? Or we may not even get to that point anymore because you've shown us that you can't manage it, right? So, and I don't know if there's anything else you guys wanted to add.
Thank you for the question and expanded discussion. Jennifer Carr for the record. Yes. The way you described it there at the end, yes.
Just wanted to make sure. I don't have any other feedback or suggestions. I think those were my main concerns. It sounds like we're all on the same line of thinking. So hopefully, I hope that the regulations do come up good and that you don't face too much pushback, because I do think that these are worthy discussions, and I hope that the legislative record reflects it. So, okay, we're going to go ahead and begin testimony. So if you would like to testify in support of Senate Bill 43, we ask for folks to come forward here in Carson City and Las Vegas, and then obviously to queue up virtually. So we'll start here, again with the 2-minute limit. If there's anyone that would like to testify in support of Senate Bill 43, we'll start here in Carson City.
Hello, good afternoon, Mr. Chairman, Doñante, and members of the committee. My name is Maria Menjivar, and I'm the Deputy Administrator for the Central Nevada Health District. I'd like to apologize first and foremost that our administrator is not here. He had a prior emergency, but I'm here on behalf of the Central Nevada Health District to inform you that we are in support with the conceptual amendment and look forward to working with NDEP and the Environmental Commission in the development of the regulations outlined in the amendment. And thank you for your time and consideration.
Thank you so much. Anyone else looking to testify in Carson City in support? We'll go to Las Vegas. Anyone in Las Vegas for Senate Bill 43 in support? AVH, is there anyone online?
If you'd like to testify in support on SB 43, please press star 9 on your phone to take your place in the queue. Chair, there are no callers wishing to testify in support at this time.
Thank you so much. We'll move on to opposition testimony. If anyone would like to testify in opposition to Senate Bill 43, we'll ask to come forward. Seeing none in here in Carson City and none in Las Vegas, AVH, is there anyone virtually?
If you'd like to testify in opposition on SB 43, please press star 9 on your phone to take your place in the queue. Chair, there are no callers wishing to testify in opposition.
Thank you so much. And any entity that's looking to testify in neutral on the bill, if you can please come forward. Once again, this is for SB 43.
Chair Donate, Bradley Mayor of our partners for the record, representing Southern District, to thank.
Can you use that mic? I think this one's acting weird. And start over, please.
How's that? Okay. Thanks. Senator Donate, Bradley Mayor of Argenta Partners for the record, representing Southern Nevada Health District. So at the Health District, we want to thank NDEP for working with us for discussing the original concerns that we had in the original version of SB 43. We're neutral with the amendment because it resolves that concern by ensuring that any delegation of both the Solid Waste Management and Safe Water Drinking Act authority will continue to occur through an interlocal agreement between the state and local health districts, with the health districts involved in the development of that criteria. So we thank you.
Good afternoon, Chair Dunyate and Committee. For the record, my name is Joelle Gutman-Dodson with the Northern Nevada Public Health, and I'm here today in neutral on SB 43 as well. We wanted to thank Administrator Carr and her team at NDEP for bringing this amendment. The amendment provides the clarity we were looking for, ensuring that any delegation of solid waste management and safe drinking water systems are made in collaboration with local health authorities through interlocal agreements. Thank you.
Thank you so much. Anyone else in Carson City? Anyone in Las Vegas? AVH, is there anyone online?
If you'd like to testify in neutral on SB 43, please press star 9 on your phone to take your place in the queue. Chair, there are no callers wishing to testify in neutral.
Thank you so much. Administrator, do you have any closing remarks?
Thank you, Jennifer Carr, for the record. I just wanted to thank the chair for bringing this to a hearing today, as well as the committee's active engagement in reviewing this and asking questions. And I very much want to extend my appreciation to everyone that's been involved in the process, because I think it's made it a better bill. Thank you.
Thank you so much. We're going to go ahead and close the bill hearing on this bill, and we'll bring it, won't be the last time we talk about it, but we'll move on now, and I appreciate everyone. And then last but not least, we're going to move on to opening the bill hearing on Senate Bill 185. This bill revises provisions relating to Medicaid reimbursement for the care of disabled or chronically ill children. And with us, our Vice Chair, Ms. Taylor, is going to be presenting, and it is her first bill in the Senate, so in the better upper house. So you may begin when you're ready.
Thank you, Mr. Chairman. To Chair Danyante and the committee. For the record, I'm Senator Angie Taylor, and I proudly represent District 15 in Washoe County. It is my pleasure to present Senate Bill 185 today. It is my first hearing in the Senate, and I'm very excited about it. This bill revises provisions related to Medicaid reimbursement for the care of disabled or chronically ill children. For a little bit of background information, I got this bill from a constituent. There was a time when I served on the school board, and we liked to go to the first day of school. It was the first day of kindergarten. And there was a severely disabled young lady going to kindergarten, and her mother was with her, and she was a bright young woman. She was a child, bright child, really exuberant personality, and her mom was caring for her and had quit her job to take care of her. As I became an assembly person last year, she came to meet with me and just talked about some of the challenges that she faced. And the bill before you today addresses a critical gap, which is where those challenges come from. There's a gap in the support system for families who care for children with disabilities or who have chronic illnesses right here in our state. Currently, Medicaid covers personal care services by outside caregivers for eligible individuals, adults or children, but families who dedicate themselves to providing this essential care for their children often face extreme financial strain. These families make immense sacrifices to secure their children's, to ensure that they receive the necessary support for their daily living activities and allowing them to remain in the comfort and security of their own home. Senate Bill 185 seeks to alleviate some of the financial burden by requiring Nevada's Department of Health and Human Services, DHHS, to reimburse family members who provide the personal care services to Medicaid recipients under the age of 18 who have been diagnosed with a severe disability or with a disability or chronic illness. The intention is for family caregivers to have the same requirements that are regular outside, if you will, caregivers to have. This measure really acknowledges the vital role that family members play in providing care and aims to provide them with some financial assistance along the way to help cover those expenses related to that care. And by supporting these families, we can improve the quality of life for these children with disabilities, we can prevent potential caregiver burnout, and promote family stability and well-being. This bill, I believe, is a crucial step towards ensuring some of Nevada's most vulnerable children receive the care and support that they need, while also recognizing the valuable role and contributions of their family members. Chair, unless you would like, I won't walk through the sections of the bill. It's a pretty small bill and pretty straightforward, but I'm certainly prepared to answer any questions that the committee may have at this time.
Thank you so much. Committee members, any questions? Senator Stone.
Congratulations, Senator, on your first bill here in the Senate, and I think it's a great bill. Can you just talk about the quality of care that's going to be provided by family members, how it's going to be monitored and ensured? Is there going to be any kind of training involved for the family?
Thank you, Senator. If I may, directly to the Senator. Yeah, the same requirements that caregivers have will be, those same requirements will be on family caregivers. Right now, it's just that those family members can't get reimbursed for the same care that they would pay for an outside, but no differences. So the same care, same monitoring that we currently have in the system with our Medicaid system.
Senator Titus.
Thank you again for that. I just to get, were some of these caregivers that are reimbursed and licensed personnel, they have to do background checks and some of these other things. So I'm just wondering if there will be any, if it's a family member, do they have, I'm not, is it exactly the same? There's no monitor, they're gonna have to have background checks, some licenses, or no, just a caregiver with no, they don't have to apply for any licenses, or if they're acting in a capacity as a professional? Is there a difference in that?
Thank you, Senator. My intention, and then speaking with Administrator Weeks on this, is to have the same requirements for in-home for family member caregivers that currently exist in Medicaid for outside caregivers.
I think we'll have to reach out and make sure that the outside caregivers don't have some regulation and oversight, because I'm not clear if they do or not. If they're getting paid for, their outside caregivers are getting paid by an agency to come in and take care of mom or dad, aren't there some regulations for them? I appreciate the reimbursement, and I like the bill, but I'm just wondering about the regulatory process and any rules that they must follow.
Senator Titus, can I ask you if maybe this can help answer, and of course if Senator Taylor wants to respond, are you asking because of more of someone being a fiduciary responsibility for as the payments are being processed, or like
No, the actual administering of care as a caregiver, because they exist already. You can pay somebody to come in and be a caregiver to a family member, and then and you have to pay for that. Now you're having a family member be the caregiver. They don't have to be licensed under any title, but they can, it's a personal care services. And I don't know, and I'd have to see what the regulations are for Medicaid to do the personal services, if they reimburse for that, if it's a non-family member, and what their rules are. The oversight is what I'm asking.
Yeah, and Senator Taylor, you may be able to respond to it. So my understanding is this is the policy discussion that we're having right now, right? There are different levels of tertiary services of care that I, as a parent, if I have a child that's diagnosed, can receive. The issue that we have generally seen with personal care not being directly being reimbursed, and why some states don't do it, is because there's a concern of fraud, waste, or abuse that may be taken, and so that's why they share it with the idea is that if you have third parties administer it, then you remove the conflict of interest. But from what Senator Taylor's advocating is clearly that's not the case if parents are ultimately the ones that are responding and having to take care of the children. And that's why there's 38 other states that already do this directly. And I think maybe if you can speak about the testimonials of why parents are asking for this.
Okay, thank you, Senator. And I think your question, Senator Titus, is sort of along the lines of Senator Stone's question. Is no one wants the fraud, the waste, and the abuse. There are over 30 states that currently allow family members to be reimbursed in this manner, and it's the theory behind it, if you will, the thinking is that because they're family members, and in most cases they're parents, that they're going to be able to really administer a higher level of care because of that personal connection, and because I do know that they're if there's a way to cheat, some people will always try to do that, and that's why the intention is whatever their same requirements are. And I actually had those notes and I left them in my office. It's kind of a busy Black History Day today. But the same requirements that are required from outside caregivers, we want to say the same. My intention is to require have those same requirements for family members. But I'll get that, and I can send that to the committee, to the committee secretary, and have those sent out just exactly so we know exactly what those are, because I share that same concern. Thank you.
Any other questions? Ms. Cooper, will you say something? Are we good?
Destiny Cooper, for the record, LCB nonpartisan staff. I was just going to say that there is a subject matter expert if there's more direct questions. I don't know if that answered your question or if you want to follow up.
I'm okay with phoning a friend.
Good afternoon. Kirsten Kulam, Chief for Long-Term Services and Supports with Nevada Medicaid, and you did a very eloquent job, as well as you, Chair. So there's kind of two questions I think that came up. So in terms of the background checks, any family member would have to enroll through a personal care agency, and so then that personal care agency, which I also phoned my friend back there in the last row with the Bureau of Healthcare Quality and Compliance that oversees the licensure for those agencies, so there would be no deviation or carve out for family members, so they would have to undergo those background checks. You'd have that agency that would be responsible for managing that. And then conversely, what this bill does, because we do offer personal care services in Nevada, and there is a federal Code of Federal Regulations that does prohibit the family members, which would be what this would give us the authority to do through a home and community-based authority, either a 1915C waiver or 1915I state plan option. Sorry, it's a little Medicaid speak, but what comes with those additional, the home and community-based authorities is enhanced quality assurance that we would have for those services that are being rendered. So I hope that helped answer some of
That
those questions.
answered both of my questions.
Oh,
Thank you very
fabulous.
much.
Stay there because I have a whole bunch more. Please. Dun dun dun. No, it's okay. Well, so Senator Taylor, you and I have had this discussion before. I had a roundtable probably at the end of October with family members that have, not family members, but parents who have children that are diagnosed with cancer in Las Vegas. And this was like their top issue. And it's incredibly hard because when you have a child that gets diagnosed with cancer, such a debilitating disease, what folks don't often realize is that usually one parent has to go and sacrifice their job and they can't go to work anymore because they have to take their kid to the appointments and they build off to another, and then you have to take them to the laboratory, and then if they have surgeries and you have to be there to take care of them, and if they need PT, right? Like it keeps adding on and on and on. And I think that it kind of illustrates that, oftentimes these are moms that are doing this hard work and they go uncompensated. And I think it's kind of, it's all part of it. And so I guess the questions that I had that were highlighted is, number one, on section 1, subsection 2, when it deals with less than 18 years of age. I know in other parts of the law that we've talked about increasing level of services for foster kids, et cetera, up to the age of 21, or for children that are diagnosed with autism or other disabilities. Can you speak? Is that something that other states have done? Do you know by any chance, or should we increase that from 18 to 21 as long as they're covered dependents? Is that something that or maybe it could be 26 as long as they're covered dependents and the parent is still managing the level of care? I think that's more of a semantics issue.
Yeah, Kirsten Cohen for the record. So in Medicaid, we do often cover services up to 21 because of the early, I might get this acronym wrong, EPSDT, the early periodic screening treatment services that basically, as long as the service is medically necessary, then that individual would qualify for those services. So there is that, not to say a gap, but there is that range for quote unquote children in Medicaid up to 21. So that could be a consideration.
Thank you, Chair, for that question. I think that would be great to increase that age because, as you said, the parents who are caring for their child, they don't stop caring for their child when their child is 19 years old. They're still the dependent. They still really rely upon that care, and most of the time they are parents. So I'd certainly be interested in an amendment to that effect.
Sorry, if I may, and this might be why it was drafted this way. Oh, thank you, Kirsten Cohen for the record. So technically, and Mr. Robbins can correct me at any time, but I think maybe the reason the bill stops at 18, even though I just mentioned about the 21 for services, is because then that legal relationship for the minor, unless the parent actually had guardianship over that individual, then they technically would no longer be considered that legally responsible individual because that minor after 18 would be considered an adult. And so then it, in essence, we wouldn't have the scenario that we're in because the parent could be that caregiver without the current limitations that we have, because that the parental requirements essentially go away at 18.
Thank you. And then, so follow up to that, because I have like a series of questions. The next one that I have is probably in terms of eligibility and medical necessity. So I know that the bill talks about disability or chronic illness. What I'm scared of is a scenario where obviously, like, we want to make sure, like, if your kid is diagnosed with cancer, right, like, you have the ability to services. But there may be some parents out there that say, well, my kid has asthma, and that counts as a chronic illness, and I have to take my kid for his chronic asthma to doctor's appointments. I should be compensated for that. And so is there provisions of like what medical eligibility would look like, or have you looked at how other states require like some level of documentation from the physician or recurring visits? Like, I don't know if you've done, like, if this has come up or in any conversation, and feel free to say no, but.
No,
yeah.
just somewhat, and the line would be drawn if you're eligible for that kind of care for your child. So if your child has asthma, and Medicaid does allow your child would be, if under those circumstances, if your child would be eligible for that care from an outside caregiver, then it would apply. But if your child would not be eligible for that care from an outside caregiver, then it wouldn't apply. That's as far as I went extent-wise.
Yeah, thank you. And then I think we covered the fiscal intermediary kind of conversation, so I don't want to ask about that. I guess the only thing that I wanted to just ask is, I'm assuming we already have penalties for fraud if we discover that a parent may have abused the system, or if they are taking advantage of this. For example, like, we're paying them for their personal care services, but they're not taking the kid to the doctor's appointments that they were entrusted to take to, right? And it leads to this whole issue of abuse. And so I'm assuming you already have the authority to revocate or remove them from Medicaid or take away certain programs if they're identified as part of this system, and it doesn't need to be added into this bill, but I just wanted to make sure that you already have that statutory responsibility.
Kirsten Kulam for the record. So yes, because the family caregiver would be enrolled through that personal care agency, upon any type of quality assurance review was found that those services weren't rendered, or whatever scenario that might constitute a level of fraud. We have a surveillance utilization review unit that, I mean, our assumption is that it's not fraud. It's, oftentimes we try to start out softer with education. A lot of times it's just education from a provider standpoint. But ultimately, if there was, Medicaid has the ability to recoup any Medicaid funds that were spent related to fraud, and then that would be through the agency that employs the caregiver. So then it would be between the agency and that employee.
Just as a final follow-up, to be clear, the parents that would be enrolled as part of this program would have to take some level of training requirements as they're getting enrolled, as to, like, here are the benefits that you're now entrusted to and the legal obligations, so that you don't fall into that circumstance, correct?
Kirsten Kulam for the record. So yes, there are required trainings that is required through the Bureau of Licensure and Certification. These particular services are activities of daily living, so bathing, dressing, grooming. They're not necessarily our skilled intervention. So yes, the thought is that they know how to perform these services because they're doing it already. Oftentimes there's uncompensated care with family members. But yes, that would be on behalf of the agency that is employing those caregivers to make sure that they are educating them on ensuring that the services are rendered.
I think I inspired Senator Titus to ask more questions. Do you have one?
Yes, I do. Thank you, Chair. And yes, the conversation has led me a little bit down this rabbit hole here. So that's what you would think be the typical ADLs, we call them activities of daily living. But I know that family members do and can care for loved ones that may have more needs than that. And so that would be maybe a separate conversation, because it's not just bathing, cleaning. And some of these impaired, especially children, they might have a trach, they might have catheters, and family members can take care of those sometimes. And so I'm just wondering, is there a line drawn there, or is it something that, because again, parents do some things that typically maybe the outside provider would not be allowed to do, but they're by necessity and their family members. I mean, we had to bill one time, I know, because in certain houses, the caregiver couldn't give an insulin shot, but the parent was assisting with the insulin shots. And so you had to get a special, that was one of the bills we had to pass in certain situations, that they could do an insulin shot in some circumstances. So I'm just wondering if that really addresses that.
Kirsten Kuhn for the record. So our definition of personal care services, which is what this bill addresses, is limited to those activities of daily living. So bathing, dressing, grooming. So it doesn't have transferring. So it doesn't have those skilled interventions. That's where we would have like private duty nursing or home health agency that has those skilled nurses or, come out to do those, perform those skilled services. So this is that lower level of care.
And just to follow up, say if I was an RN and I wanted to take on more of that responsibility instead of having to go through a third party, this bill doesn't cover that, but there would be avenues if that was the case later on. Is that accurate?
Kirsten Kuhn for the record. So those skilled services are through a home health agency, and so if there is which Medicaid does cover private duty nursing and home health services, so there's potential where that nurse could be employed by that home health agency and then get reimbursed for providing that care. The home health agency would just have to hire that individual.
Let's come back to that on a different subject, though. I want to see if I can fix that. So,
Okay.
Any other questions? No? All right, we'll go ahead and open it up to testimony. So if you're here to support and testimony in support of this bill for Senate Bill 185, we ask for folks to come forward here in Carson City and in Las Vegas. We'll start first in Carson City. Please begin.
Hello, Chair Doñate and members of the Senate HHS Committee. My name is Carissa Pierce, Carissa Pearce, and I am representing the Children's Advocacy Alliance as our Government Affairs Manager. CAA is an independent voice for Nevada's children, advancing systematic change in the areas of early childhood education, children's health, and child welfare to ensure every child in Nevada thrives. Family members are already acting as primary care providers for a child in their family with a disability or chronic illness, and they're often the best care provider for that child. SB 185 will support children to receive care at home or in a setting that they are comfortable with rather than being sent to a long-term care facility. And Nevada has a shortage of providers, including those who provide ongoing care for children with disabilities. Allowing a family member to be reimbursed under Medicaid for providing that care shows that we value the strength of the family unit and recognize their efforts to support the provider shortage. This bill allows the emotional and financial capacity to make hard decisions around the child's care, including whether a parent or family member will sacrifice their income in order to care for the child, knowing that they will be supported financially for the care that they're providing. Thank you for the opportunity to provide comment and for your commitment to Nevada's youth.
Thank you so much. Anyone else looking to testify in Carson City in support? We'll do one more and then we'll go to Las Vegas.
Hello, Annette Logan Parker for the record. I'm here today, first off, to thank the committee on hearing this bill. It's very important. I'm representing Cure for the Kids Foundation as well as the Nevada Rare Disease Advisory Council. So I really am in strong support of SB 185, and I'd like to highlight some potential key amendments that might be interesting. At Cure for the Kids Foundation, as you well know, we hosted the roundtable that you referred to earlier. We see firsthand challenges.
Annette, sorry to interrupt. So if you have conceptual amendments, they have to go during neutral testimony.
Okay.
Yeah.
Perfect.
So do you want to just continue in support and then send your amendments to the bill sponsor later on, or do you
emailed them to the bill sponsor already earlier today.
So do you want to come back in neutral testimony when we get to that, so that you can share with them? Okay.
Yeah,
I just want to make sure that we're on the right.
Yeah, absolutely.
Okay.
Okay. Perfect.
Let's continue on with support. I think I see someone in Las Vegas, so we'll go there.
Thank you, Chair and members of the committee. My name is Terrence Thornton. I'm the President and CEO for Special Olympics Nevada, and I am here in support of SB 185. The bill removes an unnecessary barrier for families with disabled children. While Medicare covers in-home care, parents, the most qualified and invested in their children's well-being, are currently ineligible for reimbursement if they become the caregivers. SB 185 corrects this oversight, ensuring parents that have the financial support they need to care for their children. I appreciate Senator Taylor for her bringing this important bill forward, and thank you.
Thank you so much. Anyone else in Las Vegas? AVH, is there anyone online?
If you'd like to testify in support on SB 185, please press star 9 on your phone to take your place in the queue. Caller with the last 3 digits, 304, please press star 6 to unmute yourself.
Chair Doñate and members of Senate Health and Human Services Committee, my name is Chelsea Bishop with Acts for Kids Nevada. As an advocate for families in Nevada, I share support for the potential large benefit of the services written in Senate Bill 185, the act that would revise these provisions for chronically ill children. We at Act for Kids Nevada have been hearing from families accessing health care for their children in Nevada. Families are sharing stories with us with the difficulties they face navigating the fragmented healthcare system. So many of these families are feeling the incredibly large burden of caring for their children, especially those with complex medical needs. There's an extra burden in this state as our healthcare system for kids is siloed with no comprehensive children's hospital or statewide healthcare system. These families often find themselves making difficult choices in their employment in order to ensure their children are getting the care they need. 2-income households going to one, and 1-income households having seemingly impossible decisions to make. Children with complex conditions are most often covered by Medicaid. SB 185 has the great potential to ease these financial burdens for Nevada families, ensuring that they can care for their children in their home, with the caregiver being someone they are comfortable with. Personally, when my daughter was diagnosed with stage 4 high-risk neuroblastoma in 2015, our family found ourselves in this situation. My husband and I decided that we would have him continue to work while I quit my job. This was a very difficult decision as I had better health insurance than his. Our family could have very potentially have greatly benefited from this positive repercussions from this bill. So many families in these situations are in need of support. In your decisions around SB 185, I urge you to support Nevada families and show our state's commitment to children. Thank you so much for your time.
Good afternoon, Committee Chair Doñate, Vice Chair Taylor, and members of the committee. My name is Rebecca Acosta, and I respectfully submit support for your Senate Bill 185, revising provisions relating to Medicaid reimbursement for the care of disabled and chronically ill children. As a pediatric health advocate, I often work with families whose children are disabled or who have profound special needs. They are largely struggling in silence as community resources and support programs are either unavailable, subject to budget constraints, or have years-long wait lists. In 2-parent households, one parent is often forced to leave their employment to provide for their child's needs full-time. In single-parent households, families have incredibly difficult choices to make between their child's care and providing for the household's needs. No matter how we slice it, these families are in desperate need of our support. Children with disabilities and profound special needs are most often covered by Medicaid. Enacting the provisions of SB 185 will ease their financial burden of caring for their child with disabilities by providing reimbursement for personal care services they are already rendering. It will also show our state's commitment to supporting these families and giving value to the critical work they do. This provision will lift up children and families across Nevada who have largely been forgotten. I urge you to make the right choice for Nevada's youth and families and pass SB 185. Thank you so much for your work and your time today.
Chair, there are no more callers in support at this time.
Thank you so much. Anyone in opposition to Senate Bill 185, if you can come forward here in Carson City. Seeing none, none in Las Vegas. AVH, is there anyone online?
If you'd like to testify in opposition on SB 185, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you so much. And next, we'll go to neutral testimony on Senate Bill 185. So now we'll go ahead and continue with this. And Ms. Logan Parker, if you can start from the beginning, that way they capture your full remarks.
Sure. Thank
Yep.
you so much. Annette Logan Parker for the record. Thank you to the committee for allowing me the opportunity to speak today. I'm here to express strong support, but at this point neutral because I have some suggestions I would like to highlight. So Cure for the Kids Foundation sees firsthand the challenges that families face in caring for medically complex children. This bill is a step in the right direction, one that acknowledges the vital role family caregivers play. However, it can be improved. Like we were discussing earlier, under current Medicaid policy, only professional caregivers are reimbursed through the agencies that they're hired for, when we know that parents are providing the majority of these types of services. Many parents at Cure for the Kids struggle to balance work and caregiving, often forced to choose between their livelihoods and their child's health. So I can get right to some of the recommendations. One would be to expand reimbursement eligibility for part-time. Some children that we've seen need frequent but not continuous care, 24/7 care. So having these eligibility open up to kids who are disabled and have chronic conditions but might not meet the continuous care requirement, those families could also truly benefit from this type of a program. Secondly, allowing non-parent caregivers, family caregivers, such as grandparents, adult siblings, or other relatives. What we've seen at Cure for the Kids Foundation is family members are often the backbone of the children's medical journey. And several times, non-parent caregivers are assigned these tasks within the family dynamic, allowing the parents to go to work and or address some of their other health conditions that they might have. So I think Nevada has an opportunity with SB 185 to really look at some of the programs that have been done. Example might be California's Home Supportive Services or New York's Consumer-Directed Personal Assistance Programs that have broad definitions under these areas. One of the things that, from our perspective, that we also want to really recognize is that care being given in the home like this can be cost saving, because a lot of times children end up in institutions when the families become fatigued or they have their own health issues and things like that, when there are other people in the family who could come and provide those services. So it could potentially be keeping children out of long-term skilled nursing facilities or expensive institutions during those periods of time. Thank you, and I appreciate your investing your time and resources into this matter. Thank you.
Thank you so much. Anyone else looking to do neutral testimony on Senate Bill 185? Seeing none in Carson City. I see no one in Las Vegas. AVH, is there anyone virtually?
If you'd like to testify in neutral on SB 185, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you so much. Senator Taylor, did you have any closing remarks?
Yes, thank you very much, Chair. Senator Taylor, for the record. Just as has been stated, family members are already providing this care. This just gives us a step in the right direction to acknowledge the financial strain as well as the emotional strain that family members often incur when they're dealing with children who are disabled or chronically ill. So what I'm hoping is that we can move this forward and provide some much needed support for these families and for these children. Thank you so much. I appreciate it.
Thank you, Senator Taylor. And obviously, I'm sure you'll make changes to the bill, so just let us know when you're ready for that. All right, we'll go ahead and close the hearing on this bill. And we are now at public comment. So if there's anyone that would like to provide public comment, to please step forward. Just a reminder that we will limit to 2 minutes each. Is there anyone in Carson City? Anyone in Las Vegas? In AVH, is there anyone online?
If you'd like to participate in public comment, please press star 9 on your phone to take your place in the queue. Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much. Committee members, any comments before we adjourn? Seeing none, we're going to go ahead and call it a day. We had 3 successful bill hearings, and we are going to meet on Thursday. So thank you so much, everyone, for joining, and the meeting is now adjourned.